Welcome to the Kohll's Healthcast, where we bring you expert insights into health and wellness to help keep you and your loved ones safe. I'm Max Kohll, your host for today's episode. As flu season ramps up across the country, we're diving deep into the latest data on influenza trends, what it means for you, and how Kohll's can help you stay protected. Today's episode will go in depth into the trends, the science behind flu prevention, and the steps you can take to safeguard your health. Let's start with the current landscape of flu activity in the United States. According to the Center for Disease Control and Prevention, emergency room visits due to influenza are classified as very high nationwide. This year's flu wave arrived later compared to the past 2 years, but it's proving to be just as intense. Flu seasons can vary widely, and this year's activity is closely mirroring what we saw in the 2019 to 2020 season, peaking around the new year. However, regional data tells an even more concerning story. Western states, such as Oregon, are experiencing levels of influenza that have surpassed the peaks of last winter's flu season. For example, Oregon Health and Science University Hospital reported that 8.4% of emergency room visits at the end of December involved flu cases, 3 times higher than last year's peak. The numbers are staggering. In November and December of 2024 alone, Oregon's hospital system treated over 1,100 cases of influenza, compared to just 251 cases during the same months in 2023. Daily tallies of flu patients are among the highest recorded in recent years, second only to the 2022-2023 season's unprecedented surge. This uptick highlights the importance of staying vigilant and proactive about flu prevention. Now, you may remember the term tripledemic from previous years when RSV, flu, and COVID-19 collided to create a perfect storm for public health. In 2022, this combination led to a public health emergency and crisis standards of care in many hospitals. Thankfully, experts believe we are unlikely to face another tripledemic this year. One key difference is the timing of the respiratory virus season. COVID-19 levels have only recently started to climb in parts of the country, and so far the winter wave is not expected to reach the same heights as previous years. The CDC attributes this to the absence of a new immune escape variant and widespread immunity from vaccinations and prior infections. Current COVID-19 strains such as XEC and LP81 remain closely related to earlier variants, and wastewater data indicates only a moderate rise in activity. This delayed COVID-19 surge is providing some breathing room for hospitals, but it's important not to let our guard down. The flu virus remains unpredictable, and its impact can vary depending on vaccination rates, population density, and other factors. Let's talk about prevention. The flu virus is a master of mutation, which is why annual vaccination is so critical. Each year, the vaccine is reformulated to target the strains most likely to circulate. This year's vaccine is designed to address the specific strains currently driving the flu wave. Vaccination is especially important for vulnerable populations, children, older adults, and those with compromised immune systems. Even if you've already had the flu this season, the vaccine can protect you from other strains. It's also worth noting that vaccination helps reduce the severity of illness and lowers the risk of complications like pneumonia or hospitalization. One common misconception is that it's too late to get vaccinated if flu season has already started. In reality, flu activity often extends into the spring, and getting vaccinated now can still offer significant protection. Remember, the flu shot not only protects you, but also helps reduce the spread of the virus in your community. At Kohll's we're committed to making vaccination as convenient and accessible as possible. Whether you need a flu shot for yourself, your family, or your workplace, we've got you covered. Here's what we offer. Walk-ins are welcome. No appointment, no problem. Stop by any Kohll's location during business hours to get vaccinated. Schedule appointments. Prefer to plan ahead? Visit kohlsrx.com/vaccines to book a time that fits your schedule. On-site clinics. We bring our vaccination services directly to your workplace, corporate office, or organization. This is a great option for employers looking to keep their teams healthy and productive. At-home vaccinations. For those who are homebound, our team can administer vaccines in the comfort of your home. Community clinics. We partner with nursing homes, senior centers, and developmental disability organizations to ensure these vulnerable populations are protected. Our professional healthcare team ensures a seamless, safe, and efficient vaccination experience. Whether you're visiting us in store or scheduling an on-site clinic, you can count on KohlsRx to deliver top-notch care. Let me share a quick story that highlights the impact of our services. Last year, we partnered with a local senior center to vaccinate over 200 residents and staff members. Many of these individuals hadn't received a flu shot in years due to mobility issues or logistical challenges. By bringing the clinic to them, we not only improved their health outcomes, but also created peace of mind for their families and caregivers. These are the kind of success stories that motivate us to do what we do. Vaccination is about more than just protecting yourself. It's about creating a healthier community for everyone. As we wrap up today's episode, I want to leave you with one simple message. Don't wait. The flu season is here, and it's not showing signs of slowing down. Protect yourself and your loved ones by getting vaccinated today. Visit kohlsrx.com/vaccines to schedule your flu shot, or stop by your nearest KohlsRx location. Together, we can make a difference in fighting this year's flu wave. Thank you for joining us on the KohlsRx Healthcast. Stay safe, stay healthy, and we'll see you next time.